We're going to talk about physician employment contracts. This is a difficult topic because there's little published data, there's considerable variability between contracts, and this is, particularly in recent years, confounded by non-disclosure clauses in those contracts. One thing that's fundamentally changed in this century is physician practice ownership has gone from primarily physician-owned practices to primarily hospital and health system-owned medical practices just in the course of a few years. Employment contracts are designed to protect the employer. This is an important thing to remember when you're reviewing it. And the employer has significant negotiating advantages over the potential employee. You need to read the contract and understand it before signing it, and get professional help in the form of a lawyer when needed. The contract has some basic components: duration, duties, compensation, and termination. It also has things like what parties are involved, what is your job title, and what qualifications do you need to maintain, such as board eligibility or board certification, and usually current medical licensure. The duration of the contract is usually 2 to 3 years. Longer term contracts pushing 3 and 4 years have become more common, and it will often talk about the renewability of the contract in this section. Duties is usually fairly straightforward. It has expectations and a job description. It may refer to an employee manual, which would have additional duties. Compensation, that's usually the easy part of the contract. It discusses your salary and bonuses, how productivity is measured, when you'll be paid, and other factors. Termination, or when the contract ends, when it expires, if you're terminated with cause, meaning fired, or if it's terminated without cause, such as if the practice eliminates a department and they no longer need your services, or if you decide that you no longer want to work at that particular location. The other thing to think about is this clause or a section of the contract also usually discusses transferability. Can the contract be transferred to another entity that buys the practice? Could your contract even be sold to another practice? It's also important because these will usually refer to exhibits, appendices, in an employee manual, that you review those and understand how those will impact you as a physician working for that employer. There are a couple of areas for careful review. One is signing bonuses. A couple of the most common questions are, how much is it and when will I get the check? But the important question is repayment required if the contract is not completed? Sometimes it's very clear, other times it's not, and you should have a clear idea of what would happen with the signing bonus if you're unable to fulfill the contract for any reason. There are a couple of reasons that a contract may not be completed, such as a change in your personal health, your family situation, challenges related to your licensure and or board certification. It could also be something as simple as a great job elsewhere, dissatisfaction with the practice location, or possibly even practice closure. The next area of particular importance is to look at non-compete clauses. Non-compete clauses are designed to protect the employer, and they're legal and enforceable in most states. There are a couple of states that prohibit non-compete, most importantly California, North Dakota, South Dakota, and Montana. Virginia prohibits non-competes if the employer is a general corporation, and Tennessee prohibits non-compete unless the employer is a hospital or medical school practice plan. With the practice trends that we've already discussed, where most physicians are now being employed by hospitals and large health systems, the prohibitions against non-compete in Virginia and Tennessee have substantially diminished in importance. So for most physicians in Tennessee and Virginia, it is likely that a non-compete exists and is fully enforceable. The activities that may be limited by a non-compete agreement would be taking patients with you, practicing medicine. It may be practicing medicine of a particular specialty, or it may be any practice of medicine, and it may also prohibit your employment by a competitor. The locations that may be restricted would be a radius of a certain number of miles from a location, specific hospitals. It may be specific to a city, a zip or area code, or a metropolitan service area, or a metropolitan statistical area. The duration of a non-compete is usually 2 to 3 years. And most non-competes now have a buyout option. It's often very expensive. It may cost hundreds of thousands of dollars. And the price should be clear in your contract. Is it fixed? Is it based on your productivity, collections, or other factors? The next thing to think about is compensation. Like we have discussed in previous sessions, the compensation used by most practices is to have a base salary with a productivity incentive, and when those are combined, you get your total compensation. When you look at RVUs by specialty, there's considerable variation, and you should know what's a reasonable amount of productivity so you can determine the likelihood is that you will be able to meet your productivity expectations to get your productivity pay. Again, thinking about encounters, how many patients are you going to see to meet the expectations by your employer? If the number that you're expected to see is extremely high, for example, an internal medicine hospitalist, if they expect you to see 4,000 patients in a year to qualify for production bonuses, this data would suggest that it's unlikely that you would ever be able to see enough patients, because the 75th percentile for an internal medicine hospitalist of annual patient visits is about 2,200. Also look at compensation and make sure your compensation is in line with local and national comparisons for your specialty. You also need to understand the criteria for bonuses. Sounds pretty straightforward, but in an area where we're looking at controlling costs, managing and reporting quality, and demonstrating value in healthcare, this is very important to employers, and it will be very important to you. You should know how the sources of revenue, such as external support, ancillary services, and revenue sharing, apply to you, if they apply at all. In the days where most physician practices were physician-owned, these sources of income would be used as part of the compensation pool. With a physician that's employed by a large organization, such as a hospital or a healthcare system, these may not go into the physician compensation pool. So understanding this is important to fully understand your compensation model, which will most likely include a base salary, a productivity bonus, and some sort of quality bonus to give you an overall level of compensation. Other things that can be considered part of compensation would be student loan repayment, retirement benefits, a relocation allowance, paying for your medical licensure, professional society dues, continuing medical education, and insurance such as malpractice, health, life, and disability. It's important to remember that most physicians will have an employment contract. You need to read and understand this contract before signing and carefully review your duties, repayment terms for things such as bonuses and incentives, and the non-compete clause.